Generally, let's remind ourselves of the 4 C's. It's confidentiality, consent, children, and capacity. So let's start with confidentiality. What is confidentiality? Confidentiality is important because it maintains trust between the doctor and the patient. It is natural that everything the patient tells you should be kept confidential. So what does that mean? You do not have to go in each and every station and say whatever we discuss here will remain confidential. No, they don't expect you in this exam to be mentioning confidentiality in every station. You only mention confidentiality if you feel that the patient, in 2 scenarios, let's say, you mention confidentiality to the patient in 2 scenarios. If you feel that the patient is not giving out much more information, or where you feel there is a very high risk that the patient may not tell the correct information or patient may not open up. Let's look at the examples we have. Talking to a colleague or a medical student who is on cocaine. You express your concerns to him that you felt he was using some sort of recreational drugs and then is resistant or does not come forward to the problem. Why? Confidentiality. So you feel that it's not opening up. You have to offer confidentiality. So generally, when you feel that some patient or a colleague or anybody is not, feeling free to give the information or withholding the information, you must offer confidentiality. But we don't do it routinely. The second scenario is slightly different. Domestic violence. Should we wait until the patient is not able to give us information and then we can offer confidentiality? No, because this is a high-risk scenario that the patient may not open up. So it is very important from the beginning that you emphasize on the confidentiality. In here, we don't have to wait for the patient to be resistant. You may only lose time and delay things. So in this one, it's very clearly that there is a very high risk that the patient may not feel free to speak, because obviously there's a risk that somebody must have already scared her. You are not allowed to talk about this. So therefore, in this scenario, in the scenario of domestic violence, you can offer confidentiality even before the patient has demonstrated any attempt to withhold the information. So why is it required? Because it maintains confidentiality, maintains the trust between the patient and the doctor. So what type of scenarios we need to be aware about in terms of confidentiality? Now, 1, the husband wants to know the result of the blood test of his wife. 2, the son wants to know the investigation results of his mother. 'In either case, you are not allowed to disclose the information. Obviously, the husband want to know about the wife. It's easy to pick up. You want to find out why does he want to know about his wife results. But sometimes it's not easy not to tell the son or the daughter about her mother's condition. Because most of the times, it is for good reasons. So in terms of an exam, how do we go about it? It is simple. If you are speaking to a relative, and the relative has the capacity, it should be written in the task that the permission has been taken from the patient to speak to his wife, or to speak to his daughter, or to speak to his son. If that statement is not there, then you cannot disclose the information. You cannot disclose the information, or otherwise you're breaching confidentiality. What do you say? There are some few questions you need to ask them. Do their wives or husband or mother or daughter know that they are in hospital requesting for this information? Have they spoken to their relative? If they do know some information, then you have to ask them. So you have told me A, B, C, where did you get this information from? The next question you have to ask them is, are you the next kin of your wife, of your mother, of your son, or whatever it is? We need to do some sort of data gathering. Then obviously you cannot do that, so you have to apologize. I'm really sorry, but unfortunately we have not yet gotten permission from your mother, from your son, from your wife to find, to know whether she or he is happy that we tell you this information. What I can suggest for now is that you try to speak to your mother, you try to speak to your wife, or you try to speak to your daughter about this, information. But in certain situations, you can simply tell them, I will go and speak to your mother, I'll go and speak to your father, I'll go and speak to your wife to see if she's happy for us to share this information. But what I can suggest for now is for you to try and speak to them and get information from them. If they are happy after you have spoken to them, then you can get back to you and obviously explain what is happening with them. But of course, there are always minute differences. Let's look at the scenarios you have for the BAP 2 at the moment. One is an elderly woman from nursing home who has had CT scan done, which shows colonic cancer. The son is in hospital, wants to know the results. And then you have the mother who has come to the GP, want to find out whether her daughter got the contraception from the GP surgery. Though in each of these two cases, there is a risk of breaking confidentiality, the approach is totally different. In a case of the son wants to know about her mother's results, what do? You can tell him, I'll find out from your mother, and if she's happy, I'll come back and let you know about the information. In a case of the mother wants to know whether the daughter got contraception from your practice, in that case, we cannot say, okay, we'll ask your daughter, if she's happy, we'll come and tell you. No, we're going to simply send them and say, look, I think in this situation, you need to try and speak to your daughter and try to get information from your daughter. But we're not going to volunteer or suggest that we're going to speak to the daughter, and if she's happy, we're going to come and tell them. We're not going to give ourselves that job. But the way he's in hospital, and they are coming to find out the results, then we can say we'll speak to their mother, and then we'll get back to them and let them know about the information. What about the husband who wants to know the results of the wife? That one is always better to be dealt with by saying, I think I would suggest for now, if you speak to your wifey about whatever worries you or whatever concerns you have, is what I can suggest. But always try to find out the reasons why they want to find out. Well, he or she is the partner. She might feel that she's entitled to know the information. Why she's entitled to know the information? Because, well, she could be having some bloodborne infections, and she could give me bloodborne infections. That's why I want to know. So in that case, in any situation, you still have to ask them to go and speak to their partner. The next thing we're going to talk about is breaching of confidentiality.